All right, I want to welcome everyone to the Scholarly Scoop, our first virtual meeting. We have, with the help of Diane and her colleagues at the Monona Senior Center, set up this Zoom space for us. And before I introduce the speaker, I just want to also introduce myself and also thank people at the Senior Center and our sponsors. So for example, Diane, Lisa, and Lori have really helped facilitate today. I'd like to also thank the Friends of the Monona Senior Center who help support this event. For 98.7 FM WVMO, the Voice of Monona radio station, which also helps promote the event. And of course, the University of Wisconsin Whitewater. I'm a professor of sociology at the University of Wisconsin Whitewater, and this series is to highlight professors from our university and often from the College of Letters and Sciences to show you what our different professors are working on and what they're interested in. If you're just joining us, one way to help reduce interruptions is to make sure that your microphone is muted at least, unless you have a question to ask. So if all of you could hover your mouse down to the lower left corner or to the bottom of your screen where you see a microphone and click on it, you can mute yourself. If we have other problems, we might also ask you to hide your video to stop videotaping yourself, because this increases what we call bandwidth. As we go on today, if you have questions, you can either unmute and ask a question, or you can use the chat box at the bottom of your screen. And so again, if you hover at the bottom of your screen, you might see a symbol that's for chatting, where you can type in a message and either myself or our guest will see it and try to answer it that way. So Stan and Linda, are you able to mute your, it's okay, I can do it for you if you need help.
I don't see it.
Okay, oh, there, Stan got it. And Linda, I'll go ahead and mute you for now.
Please.
Is that okay? Okay.
Please.
Thank you very much. All right. So before we get started, let me tell you a little bit about our wonderful speaker today. Dr. Kim comes from the University of Wisconsin Whitewater in the Department of Social Work, and he is teaching social welfare policy. He also teaches research methods. His current research revolves around child support policy and non-custodial fathers support for the children. He's also interested in child care policy and anti-poverty policies in general, which gives him plenty of background to speak to us about recent trends in measuring and fighting poverty in the United States. So I'm going to just hand it over to Dr. Kim right now. So let's welcome him. Thank you.
To be a first speaker in this virtual the virtual presentation. So as is to combat poverty in the United States. So I teach social policy in social program. So today I combat the poverty. So if you have any question along the way, just feel free to jump in. So I want to make this presentation as interactive as possible. Before I start, if you don't have any question from the audience, as you see, I am originally from South Korea. I've been living here in like more than 10 years. So that's a little bit of about myself. So let's start. So I think we hear a lot about poverty in national crisis. People, researchers started to think about, okay, what this COVID-19 will impact on poverty. So things are issues about poverty has been around us all the time. But I think the question some of you might have had is how poverty is measured. So what government use to measure the poverty. So we'll talk about some of the methods that government has been using to measure the poverty and what are the problems of those approaches. So most commonly used poverty measure is official poverty measure. People call it official poverty measure or OPM. So this the Census Bureau. So what they do is they look at the family income. So look at, define the family of your define the family, and then look at what is the family income, how much money, cash money each family has. So they only look at the cash money. And then they compare, this is interesting, they compare the cash reserves of each family to a certain number. And that number is calculated like more than 50 years ago. So they, in 1963, again, the government, one of the government statisticians used some survey to see, okay, how much money American people at the time spend on food. So they got the number. And then they also found that on average at the time, American people, families spend about 1/3 of their income on food. So using that information, they calculated poverty threshold by multiplying the basic food, the people need, the money people need to buy the basic food, and then multiplied that number by 3. And that's it. And then we've been using that poverty threshold for the last 50 years. Although the number has been adjusted for inflation, the price change, but that's how the poverty has been calculated since 1963. So if your family income is below that poverty threshold, the 3 times of the food consumption, you are in poverty. If you are $1 above, you are not in poverty. So that's how the official poverty measure has been calculated. In terms of the cash income that official poverty measure used to assess your economic resources, these are the things that they include in your family income. So if you look at this carefully, I mean the earning, obviously your earning should be included as a family income. But if you look at this carefully, you see that there are some things that are missing here. For example, the food stamp benefit. So if a family is receiving the food stamp, that does not count into their family resources when they calculate the poverty status for that family. Or the child care assistance. Some of the families are receiving the child care assistance from the state or the federal government. That does not that is not included in the family resources in poverty calculation. Or the Medicare or Medicaid. So those are not. So you see that they only look at your cash income only, and they look at the pre-tax cash income actually. So that's interesting, right? So that's something that I'll come back to later in this presentation. Now, in terms of the poverty threshold, you remember that threshold is calculated by multiplying 3, by multiplying the basic food consumption by 3, and this is the number that the Census Bureau, the federal government, used to calculate 2018 poverty level. And let me use whether this laser point works. So, for example, if you have 4 people in your family, and if you have 2 children, this is 4 people and 2 children. So the poverty threshold is about $25,000 per year. So if your family income is below that level, you are officially in poverty by the the government standard. One thing that is, again, another thing to note is that you see the poverty threshold is equal across the country. If you, whether you're living in Wisconsin or New York City, it's the same number. So it's but people can usually see that people, if you're living in New York City, the cost of living is much higher than probably Wisconsin, but still in government, when government calculate the poverty threshold, they use the same number. So let's look at the recent poverty rate, the trends of the poverty rate using this official poverty measure. You see that this is the poverty rate from 1959 to 2018. The first one is the actual number of people in poverty, but I think a more important figure is this one, the poverty rate, because population has been increasing. So obviously number in the poverty probably has been increasing as well. That's for sure. But we have, because of that, we have to look at the poverty rate. You see that poverty rate dropped significantly from 1959 for the next like 10 years since then. But since 1970, it's been pretty the same level, around 10%, 15%. When there is economic recession, poverty rate increased to about 15%. But after that, when economy is improving, poverty rate tend to decrease as well. So that's the overall trend. But this overall trend does not tell us a lot. So we have to look at the poverty rate by different age groups or different demographic groups. So let's look at that. So this is, I think, another interesting figure here. So this is the poverty rate by age. And so what do you see? I think one thing interesting here is if you look at the poverty rate for the older adults, the seniors, ages 65 and older, in 1959 or 1960s, they are the highest poverty rate group. But then it dropped significantly since then. And then now the poverty rate for the older adults is less than 10%. On the other hand, the child poverty rate among the children is higher than the overall average, which is 16%. And then this greenish line is the poverty rate for the adults. So, but one thing to notice that does not necessarily mean that the poverty is not a problem for the older adults. But one thing clear is that using the official poverty measure, the poverty rate is lowest for the older adults. The people think, the researchers found that the reason for this change is largely due to the Social Security. So introducing the Social Security and expanding the Social Security was the main reason of the decrease in poverty rate for the older adults. Another thing to look at is the poverty rate by race and family types or some other demographic groups, but I'll focus on race and family because those are the most important factors that contribute to different level of poverty. And you see that this is the number in poverty in thousands by different racial groups. As you probably expected, the poverty rate for the Black population is much higher, more than 2 times higher than the poverty rate for the white non-Hispanic. And Hispanic as well has higher poverty rate as well. If we look at the child poverty rate by their family type, as again, probably as you expected, the poverty rate of children living in the single mother families, it's close to 40%. 4 out of 10 children living in single family households are in poverty, comparing to less than 8% for the children living in married couple families. We can also look at the poverty rate by geographic areas. And I think one takeaway from this figure is that you see that this is the child poverty rate in 2015 by county. and you see that the certain area of the United States, it's a higher poverty, has a higher poverty rate than most of the other areas in the United States. In the Midwest, the relatively lower child poverty rate comparing to southern states. But even in Wisconsin, there are much variation, and you see that this is the Madison area using, this is the 5-year average of from 2014 and 2018, and there are some, southern part of Madison has a higher poverty rate than other areas in Madison, and also you see the Milwaukee area. There are many areas where the poverty rate is, over 20%. So this dark area indicates that poverty rate in those areas is higher than 20%, or the more than 15% or 20%. So you see that just looking at the official poverty rate, national poverty rate, it's a good way to, one of the good ways to measure the poverty. But it is also, we have to look at some other subgroups to understand the poverty in this country. Now, I just talked about the official poverty measure, but what do you think? What do you think the problems of official poverty measure? So one of the is this is the same slide that I showed you before. One of the problem is that the official poverty measure still use the data from 1963. The minimum food diet multiplied by 3. And one of the studies found that actually these days American people spend only less than one sixth of their income is used on food. Lita, go ahead.
I just want to see if I understand correctly. It sounds like what you're saying is the formula used today to measure poverty actually is relying on numbers that apply to 1963 food budgets. So they're saying that in 1963, if you spent, $50 a month on groceries, that's the number they're asking and using to see if you're in poverty today in 2020, where you might spend 400 or whatever the difference might be.
That's a great question. So that's a great question to clarify. So one side, that's correct. One side, there is something that I have to say. So if you're spending $15 at 1963, then on food, the 3 times by 15 is 45. But that number has been adjusted for inflation. So probably it, even using that old calculation, the poverty threshold should be much higher than that because of the inflation. So at least the inflation, the price change has been adjusted in official poverty measure. Does that make sense, Lita? Yeah. But then still the problem is that like I said, one problem is that, these days people use, only 1/6 of their income on food, not 1/3. So that's one thing. And then these days people use different kinds of, consume different kinds of food, right? So they, probably people eat more, I don't know, Wisconsin, less cheese or something else more. So, but that has not been adjusted in the official poverty measure. So that's the problem, right? And that's one thing. And another thing is that the official poverty measure only look at the cash income, pre-tax cash income. So the tax credit is not, if you are receiving tax credit, that does not count into, that is not included in your family income when they calculate your poverty status. Or if you're receiving the SNAP or the food stamp, Medicaid, Medicare, those are not accounted for. So that's the kind of the problem in official poverty measure. So what do you think? That's interesting, right? So we really rely on official poverty measure in poverty discourse and news report, but it has a lot of issues right now. So, our government has been acknowledging the problem as well. So what they've been doing is that for the last 10 years, they are also publishing something called the Supplemental Poverty Measure. So in the Supplemental Poverty Measure is, first of all, in the Official Poverty Measure, the family is defined as people living together who are related by birth, marriage, and adoption. But in that's the family definition, the definition of family used in Official Poverty Measure. In Supplemental Poverty Measure, they also include unrelated co-residing children like foster children or unmarried partner in the family unit. So they kind of expanded the family definition in Supplemental Poverty Measure. Another change is that now in the Supplemental Poverty Measure, they actually look at what kinds of things people actually buy these days. And based on that, they calculate the minimum, the money people need for basic needs like food, clothing, shelter, utilities, using the recent data. So they use the Consumer Expenditure Survey, which is annual survey, to figure that out. Also, the Supplemental Poverty Measure adjusts for the geographic differences. So here, what basically, the left side, you see the official poverty threshold in 2016. So that's the latest data that I have for, the picture that I have for this one. But anyway, it's the same number for entire United States in official poverty measure. But in the Supplemental Poverty Measure now, New York City, for example, or the Eastern Coast area, they use higher poverty threshold for those areas because the cost of living is higher in those areas. And on the other hand, Midwestern area or this western part of the country, the poverty threshold is lower. They use the lower threshold because cost of living is lower in those areas. So what do you think? So do you think the Supplemental Poverty Measure is more reasonable than Official Poverty Measure? So we can kind of talk about that in our discussion after this presentation, if you have any question about that. And also, in terms of calculating the family resources for the poverty status, again, Official Poverty Measure only include your cash income, your wage and salary, and some cash benefit from the government, Social Security or the pension or other retirement income. But in the Supplemental Poverty Measure, now they use different ways to calculate your family resource to calculate your poverty status. So for example, if you're receiving the housing subsidy, now it's included in your family resource. If you are receiving the WIC program, which is the food support program for the infant and pregnant women, if you're receiving the SNAP, the food stamp program, those are also calculated as your family resource. But in the Supplemental Poverty Measure, they also subtract some expenses. Think about this: if you are spending childcare every month in like $500 for your childcare every month, that's not actually your disposable income. That's just gone. Once you receive your income, those $500 is used every month. So there's no control over that. Or if you're spending Medicare expense, $500 for your medical expense, that's something that you can't control a lot. So in the Supplemental Poverty Measure, if you're spending childcare, if you're spending expenses related to work, they are now subtracted from your family resource. So that they use a new way to calculate your family resource. And if that family resource is below the new poverty threshold, now you are in poverty or not in poverty according to the Supplemental Poverty Measure. Now the question you might have is, okay, so does that matter, right? So using Supplemental Poverty Measure versus Official Poverty Measure, does that make a big change? Interesting, not a lot in terms of the number. So you see that this is the blue line is the Official Poverty Measure using poverty rate using the Official Poverty Measure. And then this orange line is the poverty rate using the Supplemental Poverty Measure. So in this country tend to a little bit higher than the poverty rate using the Official Poverty Measure, but there's not much difference, right? So people might say, so it's not useful. But actually, there's a different ways to think about this. Supplemental poverty measure can actually tell us different stories about poverty comparing to using the official poverty measure. You see that this is the poverty rate for children, the left side under 18 years, under people under 18. Now, when we are using the official poverty measure, remember that, for example, in 2018, the poverty rate for the children is 16%. But using the supplemental poverty measure, it's quite substantially lower. And the reason why this is happening is because many government programs, the non-cash programs, especially the SNAP program, child care assistance, that is not included in the official poverty measure, but that is included in the supplemental poverty measure, are usually for the children. So once we include those benefits into the family resources, now the poverty rate is lower for the, become much lower compared to the official poverty measure for the children. But the right side is the poverty rate for the older adults. What do you see why this is happening? So using the official poverty measure, the poverty rate is less than 10%. And many people use that number as a way to kind of talk about poverty is not a big issue for the older adults. But if we look at the supplemental poverty measure, it's it's about 4 percentage points higher than official poverty measure. And the main reason behind this is that because supplemental poverty measure include medical expenses. If you're spending a lot of medical expenses, that is not included in your family resources in supplemental poverty measure. So you get, technically you become poorer using the supplemental poverty measure once, because medical expenses is out of the calculation. So you see that supplemental poverty measure can tell us a different story than what official poverty measure can tell us. So people, once, when I talk about this difference between official poverty measure and supplemental poverty measure to my students or other people ask, then why we still use that old official poverty measure? Looks like supplemental poverty measures seems to be more reasonable, more updated, but why do we still use official poverty measure? There are several reasons for that. One is that supplemental poverty measure only developed about 10 years ago. So for the historical comparison, we still need official poverty measure, which government has been using for the last 60 years. Another thing is the simplicity. So official poverty measure, it's pretty simple. They just look at your cash income and very straightforward threshold. If your cash income below that, you're in poverty or not in poverty. But remember, supplemental poverty measure, they look at your child care expenses, medical expenses, other kinds of non-cash benefit. It's more complicated. And also, official poverty measure is more straightforward for program eligibility. These days, most of the federal programs, the eligibility for the federal programs are based on the poverty threshold by the official poverty measure. And if your family income is below the poverty threshold, you are eligible for many federal programs. But think about this: if we use a supplemental poverty measure for program eligibility, now Wisconsin residents will have a different eligibility level, income eligibility from Illinois residents or Minnesota. It can be there may be a lot of problems, right? So that's why still official poverty measure has been used, and political reasons as well. I think this is my guess, but usually the presidents or the government officials, they don't want to change the way that poverty has been measured. And for example, if we use the supplemental poverty measure, it's still 1 percentage point higher than the official poverty measure. No presidents want to see that, right? So I think that's another reason why we still use the official poverty measure. Now, I think I have about, Lita, how many minutes do I have? How many time? Okay, maybe I'll spend about the next 5 minutes to really talk about what has been done to.
Hi, I'm sorry. I thought I had my microphone off. So you can use as, we generally go until 11, but because this is our first Zoom, we just wanted to make it a little shorter. So maybe 5 more minutes, is that okay? Or 10 more minutes?
Yeah, I'll spend about 5 to 7 minutes to
Perfect, perfect.
briefly talk about some other issues.
Thank you.
Now let's briefly talk about what kinds of things that has been tried to address the poverty. I think probably many people in the audience know historically better than me, but I'll just kind of summarize from the research about what has been done to address the poverty. Probably you remember this picture and the 1996 welfare reform. So we still, even more than 20 years since then, we still talk about this event because that was one of the most significant change in welfare history in terms of changing the trajectory of the policy approach to address the poverty. So the 1996 Congress passed the law, and we call it generally welfare reform. Basically, the previous program called AFDC now is replaced by the new program, Temporary Assistance for Needy Family. From this name, you can see that the focus now, focus has changed from the entitlement program to more temporary program. And now it's a block grant, meaning that before that, the federal government give the money to the state government based on the need of the people, how many people in poverty in the area, how many people need assistance. Now, since the 1996 welfare reform, federal government give the money, just a block grant, just a chunk of money to the state, and state has the flexibility to use the money. It's time limited. There's a five-year lifetime time limit, so you cannot receive the welfare cash program more than 5 years. Work requirement, you have to work to be eligible and continue to receive your benefit. You have to work in Wisconsin. Sometimes it can be more than 30 hours per week to continue eligibility for some of the welfare programs. And in Wisconsin, the cash assistance program introduced by 1996 welfare reform is called W-2 Wisconsin Works. So that's the kind of the big event that happened. And since then, I think this may be too simple, but I'll try to kind of talk about the major changes that happened. One thing is the restriction on the use of the cash benefit. This is not the case in Wisconsin yet, but in many other states, now the welfare cash benefit is given to you by the debit card. And there is a restriction. For example, in Kansas, you cannot use the cash benefit through the cash benefit from the state to, for example, go to the movies. There's a certain restriction in terms of what you can buy using your cash benefit from the government. And drug testing for applicants. So increasingly, many states are doing the drug testing. So if you don't pass the drug test, you're not eligible. Even if your income is eligible, you cannot get the benefit. And decrease of the cash benefit. Since the 1996, the overall trend is that reducing the cash benefit to the people in poverty. And in Wisconsin, this number has not changed since the last more than 10 years. So if you are receiving the W-2 cash benefit in Wisconsin, it's only $600. Whether you have 5 children, 1 child, it doesn't matter in Wisconsin actually. The $600 per month. Another big change is the work requirement. So to receive the benefit, now you're required to work. Like I said, for example, in Wisconsin, to receive the SNAP, the food stamp benefit, you have to work more than 30 hours per week, either participating in training program or actually doing some kinds of work. Another big change in the last 20 years is the expansion of a work support program. So the idea is that, okay, the government, we will decrease the cash benefit, but if you're working, there will be more benefit on support to help you continue to work and to kind of supplement your wage from your work. One of the main program is EITC, Earned Income Tax Credit. So the picture on the right is showing you the basic idea. So I'll just give you some examples. So here, if you're a single and one child, this is orange line is the program schedule. So you see that if as you earn more, actually the benefit tax credit increase. So you get more money from the government as a government benefit, right? And then there is a phase where it gradually decreases. But the idea is that as you work more, you get you get more or at least some benefit from through the EITC. And also childcare assistance. There has been expansion of childcare assistance for working families. So in terms of okay, so these are the changes in the last 20 years. So has that been effective to reduce the poverty? So I'll give you some conflicting data or result to kind of talk about the effects of the changes in policies in the last 20 years. First of all, if we just look at the poverty rate, not much change, right? If since here, for example, 1995, there has been some fluctuation, but not much change in poverty. So we tried different kinds of programs in the last 20 years, but poverty rate, whether you look at the supplemental poverty measure or official poverty measure, not a drastic decrease since in the last 20 years. But actually the welfare programs are doing reduce the poverty. So this is the Wisconsin data. So it's a little complicated, but the main point here is that look at this, for example, the SNAP program part. So what this graph is showing is if we add the SNAP benefit in the family income, comparing to without the SNAP reduced poverty reduced the poverty by about 2 percentage points. So that's the point, that's the story here. Without the SNAP, the poverty rate can be about 2 percentage point higher than what we have. So the program are actually doing to reduce the poverty by adding some benefits to your market income. And another thing is that the caseload, that the TANF caseload, the people who are receiving the welfare program decreased substantially since 1996. And some people actually look at that as a success of the last 20 years. So less people are on the government cash benefit, and more single mothers are working since the 1996. So some people use these pieces of evidence as a success of the welfare reform. But if we look at some other parts of the population, there are more people who are disconnected. What I mean by that is that now if you are if you're able to work, if you're deemed to be able to work by the government, but you have so many obstacles to participate in, work activities, you are left out because you're not meeting the work requirement. So those people are disconnected from the government benefit, and also disconnected from the work as well. And one of the recent study found that 1.6 million people in United States are living without $2 per day, the cash. So the $2 per day is the poverty measure that the World Bank used to assess the poverty rate for most disadvantaged poor countries in some of the countries in Africa. But if we use the same measure in United States as well, 1.6 million people are in that level of poverty. And there are so many people who are working but still poor. So looking at this pieces of evidence, some people argue that welfare reform has not been successful to reduce the poverty. So my question for you is, where should we go from here? So thinking about the ways that we measure poverty and thinking about what we have done to address the poverty, what can be done to improve or reduce the poverty. So that's it. So that's what I have for this presentation. And I think we can have some discussion following this. Lita?
Thank you. I'm trying to unmute everybody at the same time so that
Okay.
if anyone has a question, I think I have it all unmuted on, I'm not sure. I guess I'll do it one by one this way. If anyone has a question, they can begin by hovering their mouse over their microphone in the lower left corner of their giant computer screen and click on it and ask a question.
I'm wondering how raising the minimum wage would affect poverty.
That's actually a great question. So recently, the leading scholars in the United States, they came together to kind of make a roadmap for the next 10 years to reduce the child poverty by half. And increasing the minimum wage was one of those 10 policy suggestions. So they argue that the increase in minimum wage can obviously reduce the poverty to some extent. Any follow-up question or?
I have a question.
Sure.
What effect will the modernization of workforce have on the poverty level as more people are being phased out by increased technology and jobs are being lost?
Mm-hmm. Yeah, I mean, that's like $1 million question, right? But I think what I know from the research is that that's actually one of the limitations of the last 20 years of welfare reform. Remember, the welfare reform, the idea is that the welfare reform and the program since then is based on the labor market. So they argue that if we train the people into the labor market and they will get a job, and as we support them by the EITC or childcare assistance, they will be better off. But as you just mentioned, if job is not there because of technology, then, you know, what can we do, right? So because of one recent idea, you know, that has been circulating in United States and also in South Korea that I was originally from, is the universal basic income, which is still in the beginning stage, but the idea is that whether you are poor or rich, regardless of your family income status, let's give them, like one of the proposal by one of the leading scholars in the United States, so let's give each person $10,000 per year without any condition, and then people can use that to do whatever they can do to come out of poverty. So you're right. So when that's just one proposal, but you're right. So when the labor market has been changing significantly, the current welfare program is still based on the old idea of getting job and working. So I think that there is a limitation here. Thank you. I think, you know, I did this presentation last year in some other venue. I could make it more interactive, but this is a little, I would say, sorry if this was too boring to you, like 30 minutes, 40 minutes of lecture style. Yeah, Lita.
I enjoyed it very much. It is different, but I enjoyed it. I had a question about the 1/6 versus 1/3 formula.
Mm-hmm.
So you said that in the 60s, they used the food budget of the time and multiplied it by 3,
Mm-hmm.
and that was the poverty line,
Mm-hmm.
for example. And that number has been adjusted according to inflation, and we're still using it today.
Mm-hmm.
And you made a good point of how our food budget today, however, isn't really 1/3 of our budget. And so
Mm-hmm.
as a result, the poverty presented is seen as lower than it might actually be, because we actually need more than 3 times of our food budget to live in today's world.
That's right.
So I think that's you said that today and in the supplemental, they might add in food stamps, child assistance, Medicare and stuff to calculate. But isn't also the poverty line used to decide whether you receive those benefits. So as in one case, a formula might be used to decide if you qualify, and then the other formula might be used to see if you're out of poverty now because of that. Does that question make sense?
That's a great question. So because of that problem, people understand the supplemental poverty measure is probably a better way to see who are in poverty and how many people are in poverty, because it is using more updated threshold, and it also uses some updated way to calculate your family resources by adding the SNAP and subtracting some medical expenses, kind of the fixed expenses. But still, right now, most of the federal programs and state programs are using the poverty threshold calculated by that old way, official poverty measure. So, and because of that, still what the Census Bureau is doing is that they report both of them, official poverty measure and supplemental poverty measure, and people look at the different ways to look at the poverty. But in terms of the government program eligibility, the federal government and state government is still using the old way. And one reason is that, like I talked about, supplemental poverty measure is a little bit too complicated to assess. And people can argue that, wait a minute, I earned same $1,000 as my neighbor, but I'm getting I'm not getting the food stamp, but he's getting the food stamp because of that kind of the complicated formula. People might disagree with that. So I think that's one of the few reasons why people still official poverty measure is being used for government programs.
Thank you.
Any other questions?
I would say we keep borrowing money from China. How much can we keep borrowing? Taxes are being reduced for rich people. And
Oh, I'm sorry, we're having trouble hearing. Can you speak closer to your microphone maybe, or your computer that has a microphone built in somewhere?
she wants to hear what I say.
Well, I'm very sorry, we can't hear the question very well. Are there any other questions, or would you like to try to type it into the chat area at the bottom of your screen?
So when he answered my question about the minimum wage, he said people were getting together and had 10 ideas. What were the other ideas?
That's actually my great question, because that was my next slide. Assuming that someone might ask that question. Here you see that the one thing is that the first two is modification to earned income tax credit and modification to child care subsidies. So you see that these are the ideas still based on, okay, let's support the families to work more. So those are the two of the ideas to reduce poverty, expanding the works for program. And changes in the federal minimum wage, that's another thing. And also let's kind of modernize and scale up the employment program. I think that's one of the questions. That's something that's related to one of the questions previously. So more training, modernized program. And also the 5, 6, and 7, the supplemental nutrition SNAP program. This program has been, politically has been very popular, even though there are some people still, don't like the food stamp program, but because people can see it that people in poverty actually receiving the program is politically more sound and more support. So, and it has been effective to reduce the poverty, especially in the economic recession. So the ideas including expanding the SNAP program and also housing voucher program, because people in poverty, they spend more than 50% of their income in housing. So somehow the program can support their housing cost. It can reduce the poverty substantially. And supplemental security income program, which is the poverty program for some of the low-income older adults and people with disabilities. And this 8 and 9 are more like universal approach. Let's give the some amount of money to all children, regardless of their income level, which has been tried in some of the European countries. And child support assurance program is child support, if you know, is the support from the non-custodial parents. If the parents are now living together, the non-custodial parents give the money to the custodial parents to help raising the children. But the less than 50% of the custodial parents are receiving the child support because of the many reasons. So this assurance program, okay, let's let the government provide the child support to the custodial parents first, and then the government can find the non-custodial parents later, and then get the money, kind of recoup the money later. So that's the assurance program idea. So these are the I think, I don't know what is the 10th one, but these are the ideas that they came up with.
I have a question again. What are some of I know that countries have different economic and political systems, so it might not transfer exactly, but what are some programs that you're aware of in other Western countries that appear to be successful and that you think might work well in our country?
Just my personal opinion, but I think the health national, some kind of the national health program can really help the people in this country as well to first reduce their medical expenses, and also, overall, if you get healthier, then you're more able to work more and more actively. So that's one thing. And another thing is, I think the child allowance program has been, I think this has been successful in some of the European countries. The idea is that it depends on what country you're living, but about like $200 per month for each child as an allowance, without any income eligibility rules, and that has been successful in reducing the child poverty in some of the countries.
I'm assuming that those other countries, they have higher taxes to pay for that. What is the consequence on quality of life in those countries? I'm from what I see, it seems similar, but what do you learn from that side of to be paying higher?
Right. I think that there might be the cost of expanding the programs with higher tax rates, but I think overall, there are those European countries, they are economically successful as well with more generous programs. Although it's hard to as you said, compare countries with a different demographic and historical background. But I think, at least I personally think, that there are some policy ideas that still can be valuable in this country to try on, even if there might be some increase in the tax rate. Any other question? One thing, I think a couple of things that just came to me. One thing is that people now, like I said at the beginning of the presentation, people began to talk about what would be the impact of this COVID-19 on the poverty. And still people are kind of trying to figure that out. But one thing in terms of the poverty measure, we are in the 2020, but we still don't have the recent data, because the poverty rate is calculated annually using the early current population survey. So I think we have to, wait until 2022, actually, later in 2021, to see the poverty rate in 2020. So that's something that I want to mention.
It's a very relevant point right now. Thank you for bringing it up. If there are no more questions, I think maybe we can close. And if folks feel like it, they can pop their videos on now and maybe we won't crash and we can thank Dr. Kim for his presentation. And I want to thank everybody who took the time to try this Zoom meeting. I think it was wonderful and I hope we do it again. If you know friends or acquaintances that wanted to attend but couldn't, this one was recorded and Diane Mickelbank at the Senior Center will have the recording by the end of the day so that folks can opt in to watch it. All right. So I want to thank you, Dr. Kim, and those of you that attended very much. And we might be emailing you a survey with a link to evaluate the speaker today that I'll create and give to Diane to forward to you. So thank you, Thank you, Dr.
Thank
Kim.
you.
So
Thank
we
you.
can end the meeting now. Those that want to can exit out.
Okay. Thank you.